Major finding number 3, continued. There's a disagreement about whether the 809 hearing is required before an 805 report is submitted. If the 809 hearing happens, it can last and typically lasts from 2 to 5 years. So the 809 hearing incredibly lengthens the process. And there was one notable case that we were told of where the 809 hearing lasted 17 years. Because of the confusion about whether or not an 805 report should be filed after or before an 809 hearing, some physicians are allowed to continue to commit disruptive actions or various behaviors over years before there's any remediation. And it is possible, because of our system of laws, that some physicians are never the subject of peer review if they don't fall into one of the myriad requirements of peer review. We were asked to provide a cost estimate for peer review, and the estimate was between $0 and $100,000 to the entity, and that excludes physician costs and time. Typically, physicians do this with no remuneration, and so that excludes a physician's costs and time. Costs to reviewed physicians were estimated at from $0 to $100,000 also, though. Major finding number 4, the medical board procedures for the complaint process, the enforcement process, and public disclosure rules are complex, circuitous, and multi-layered. The medical board has a wonderful website with numerous public information documents, including in both English and Spanish, but it's very difficult for the general public to obtain the history of a particular physician. It's very hard to find. We found no systematic communication that existed among the various state boards and agencies that would coordinate patient quality and safety issues. And it was not clear from our investigation whether or not the board actually receives valid and complete information from the entities or individuals when they're investigating 805 reports, even with their subpoena power. The medical board investigation process is slow, and we specifically looked at different aspects of it to get average times. In 2007, it took 2 weeks for an 805 to be referred from the central complaint unit to a field or district office, an additional 1.5 weeks for an 805 to be assigned to an investigator, and then 3 to 4 months to close the complaint in the field office. If there was an administrative action, the time averaged an additional 7 to 8 months, and an accusation filing took an additional 6+ weeks. So those were the major findings that we had. We have several recommendations, and I'm not going to go into a lot of detail. I think you have a brief that talks about a lot of the specifics, but I do want to cover them briefly. So first of all, we recommend that the legislature redesign the peer review process and create an independent review organization to conduct most of peer review. And we have outlined in the report the specifics of that. We recommend that the process has an improvement. There's an improvement in transparency. And that relates to the medical board and what they're able to provide to the public, which is also dictated by legislation. We recommend a revision in some of the role of the medical board, including the responsibility of the 809 hearings being removed from healthcare entities and then put as a responsibility of the medical board. We recommend a re-emphasis and emphasis on credentialing and re-credentialing. Routine credentialing of providers and re-credentialing occur at the healthcare entity, and they should. They should continue to do that. Peer review is what occurs between those re-credentialing episodes. At this point in time, entities when a physician first asks to be credentialed in an entity, that physician is responsible for making that request and providing information. After that, for recredentialing, the organization is really responsible for saying why they should not be recredentialed. And so we would like to, rather than making the full responsibility lie in the entity, that individual physicians would be responsible for making sure that they had peer review and credentialing appropriately. We do believe that there should be the promotion of education in matters of substandard skills and technical issues where the physician could benefit from re-education. And we did identify let's see. Oh, there are also several codes that we recommended that the legislature look at for clarification. We did identify funding sources for these issues so that we would not have to increase taxes or divert other state funds. And that is laid out in our report. And lastly, we recommend that any change that's made, that you do a pilot study with a program evaluation. This is would be a large undertaking, and we recommend that you do an evaluation before you make a final decision. In conclusion, we found many negative aspects of the current peer review process. What we found as the most positive aspect in this system is the people who try to make it work. The people, all the people that we talked to tried their very best to do what they thought they were supposed to be doing to make this dysfunctional system work. We know that any alteration of the status quo will find resistance, and we understand that it will take political strength to make any changes. Thank you.